So, who's a good candidate for a penile implant? The best candidate for penile implant is a man who's tried every treatment and nothing's worked. For example, he's tried Viagra, he's tried Cialis, he's tried Levitra, he may or may not have tried penile injection therapy. He is a perfect candidate for a penile implant. Most insurance plans will cover a penile implant procedure. There are 3 types of penile implants available in the United States. The most simplest is the malleable, or what we call semi-rigid penile prosthesis. It doesn't involve any pumps, it doesn't inflate, it basically keeps the penis hard for sexual activity all the time. You simply bend it up and down when you're ready to use it. And for some men, it's perfect. The other type of penile implant is what we call a 2-piece inflatable penile prosthesis. That involves a pump to inflate the prosthesis, but then when you want to deflate it, you basically bend the penis. That is good for some men. It doesn't have as natural as an erection in both the inflated state and the deflated state as the 3-piece penile implant. So the 3-piece penile implant is what we call the Cadillac. That's the most natural. It gives you the most natural erection when you have it, and it gives the most natural flaccid, unerect state when you're not having an erection and you want to just walk around life without an erection. Makes sense, right? So once you have an inflatable penile implant, how do you operate it? Well, it's actually very simple. There is a pump in the scrotum, like a third testicle, and again, just know that we don't remove anything. Everything is put in. And the pump is like, best I can describe it, is like a small rubber ball, and you simply pump that a number of times. That creates an erection. Then when you're finished, and it will not go down until you're finished and you actually reach down again, and there's what we call a deflation button. You hit that on the pump and the implant goes down. Very simple. The great thing about penile implant is that the sensation of orgasm and ejaculation are the same as they were and the way you've known it. The only time ejaculation or the release of semen is not the same is as if you had a radical prostatectomy for prostate cancer. The implantation of an inflatable penile prosthesis is a simple surgical procedure, very much like a hernia repair. It's done 99% of the time as an outpatient. In other words, you come to the hospital, you get the procedure done, you go home the same day. And the way we do it is we usually make a small opening at the bottom of the penis where it meets the scrotum. All the components of the implant get inserted that way. We close the incision with sutures which dissolve. It's that simple. So the immediate recovery is usually 1 week. On occasion, it may take 2 weeks to fully recover. But I recommend my patients really stay in bed for 1 or 2 days. You're not bedridden for prolonged periods of time. I don't recommend driving, heavy lifting, operating heavy equipment for about a week. After that, you can resume to normal activity, and usually we wait about 6 weeks before we recommend use of the implant. The penile implants are designed to last at least 10 years, if not longer. I have several patients whose implants have lasted over 15 years. So that's pretty much very durable type of device. Satisfaction rates for penile implants are very high, 90% plus. And interestingly enough, when compared to the ED medications, the satisfaction rate for penile implants is actually higher. The biggest risk of having a penile implant is an infection. It's like anything that's implanted, whether or not it's a hip replacement, a heart valve, a knee replacement. there's always a chance of an infection. However, the infection rate is actually quite low, around 1 or 2%, a little bit higher for diabetics, maybe 5%. The other possible complications are a malfunction of the device, which doesn't happen very often, but if it does happen, it can be replaced. Those are the major complications.